This week's topic is homicide, assault, and family violence. So before we get into it, I'd like to define a few of the terms. Murder is the killing of another human being with malice forethought, with intentions of committing murder. Where non-negligent manslaughter is the killing of a human being without premeditation. It's in the heat of the moment type of killing. Where negligent manslaughter is killing of another human being through reckless actions without the intention to kill. This could be, drunken driving and killing somebody, things like that. Assault is intentional bodily harm to another person, or the intent to inflict such bodily harm. A simple assault is an act that harms another human being without serious injury or use of a weapon, where an aggravated assault is an attempt to harm someone seriously and often does include a weapon. Now, looking at the demographic factors related to homicide, we find that certain races are more likely to murder than others. It's not because of the skin color or because a certain race is just genetically more violent. It's due to the social inequalities and social disparities that are found within certain races. For example, in the United States, African Americans commit over half of the homicides. 90% of homicides are committed by males. People of a poor socioeconomic class are more likely to commit homicidal acts. 44% of homicides are due to the aftermath of an argument. 23% is due to instrumental aggression or having in the process of committing another criminal act. And 33% are for various other reasons. Looking at the connection between weapons and homicide, we see that 44% of homicides are gun-related. In fact, every 14 minutes there's a gun-related death in the United States. There's a positive correlation between gun ownership, SARI NRA, and gun deaths. This means when there's more people owning guns, the more gun deaths there are. Related to sniper attacks, 97% are male shooters and 80% are male victims. These are fairly rare offenses, and we'll talk a little bit more about sniper attacks. Well, actually, it's talked about in the book. I don't think my lecture will hit that again. But if you want a good example of a fairly recent sniper attack, you could look at the DC sniper that happened a few years ago. 29% of weapons charges are juvenile delinquents. And related to juveniles, the weapons most commonly used by juveniles are 55% knives, 24% clubs, and 21% guns. This is likely due to the ability to get a hold of such weapons. Homicide is very complex and multidimensional. There are many risk factors associated with homicide. There's some specific situation risk factors, such as the availability of weapons, alcohol and drug use, the nature of how someone is provoked into committing a violent act, a person's mental state, and a person's motives for committing such acts. The FBI puts homicide into 4 different categories. 1 is criminal enterprise, 2 is personal cause, 3 is sexual related, and 4 is group cause. Reactive violence is the emotional and impulsive act to a perceived threat, whether that's an actual threat or not. If they perceive it as a threat, it is reactive violence. Where proactive violence is a premeditated aggression for personal gain. We see these more in murder 1 type charges. Approximately 6% of all arrests for murder are arrests on juveniles. 98% of those juveniles are over the age of 15. The vast majority of criminal offenses, almost 75%, are homicides by juveniles related to a criminal activity, whereas about a quarter of juvenile murders are committed for interpersonal conflicts. Approximately half of all juveniles kill someone who is a stranger. Psychosis and paranoid ideation is fairly common within juvenile murderers. When we look at the backgrounds of juvenile murders, we often find that they have a high prevalence of family abuse and neglect, substance abuse use within the family and themselves, as well as having delinquent peers, for example, being part of a gang. Juvenile murderers often actually make good progress in treatment, especially those who have been abused. Whereas hardcore juvenile delinquents, people with real serious conduct disorders, have more mixed results when they're in treatment. The older a juvenile, the more likely they are to be tried as an adult and placed in an adult prison and not given the treatment that they possibly need. Now, switching topics slightly, we're looking at family violence. Family violence has been around since the dawn of man, likely even longer into the Neanderthals and earlier forms of human beings. We find that 1 in 5 murders are a murder against a family member, of which approximately 50% are a person's spouse. Nearly 20% of aggravated assaults and 70% of simple assaults happen against a family member. Family violence is likely very underreported because of the very touchy nature of it, the cycle of abuse, etc. It has been difficult to study because of those reasons, especially across different cultures. There's not a good operational definition of what is abuse. For example, a lot of the sub-Saharan countries perform female castrations. Well, this is a very much accepted cultural practice back in those countries, but when they immigrate to the United States, should that be considered abuse and family violence? So is this an accepted cultural practice when they move to the United States? Child maltreatment is epidemic in the United States. 1 in 7 children are maltreated at some point in their life. There's a very famous study called the ACE study, which came out a few years ago, which stands for Adverse Childhood Experiences. And this can be related to childhood trauma, abuse, things like that, where it shows that having those, and the more you have of these adverse childhood experiences, the poorer health outcomes a person will have and the lower quality of life a person will obtain as they get older. In 2003, of the reported maltreatment cases, 63% reported neglect, 19% physical abuse, 10% sexual abuse, and 8% emotional abuse. Physical abuse is physical aggression towards a child, where emotional abuse is oftentimes verbal aggression towards a child, telling them that they're no good, where emotional neglect is withholding loving feelings towards a child. Sexual abuse is obviously sexual aggression or molestation of a child. Child neglect is withholding basic needs from a child, food, clothing, shelter, those types of things. The term throwaway children is used to define children that are kicked out of the home by a parent or guardian. Therefore, they're oftentimes homeless, couch hopping, getting into trouble. Substance abuse is highly correlated with child runaways and children who are thrown away. Sexual and physical violence are also common within that population, as is criminal activity. Child abduction is usually, when there is child abduction, it's usually caused by perpetrated by a non-custodial parent. Stranger abductions, thankfully, are fairly rare. When they do occur, sexual motivation is oftentimes the main factor. 2/3 of child abductions are on females. 40% of stranger abductions, unfortunately, result in the death of the child. So moving on to some other childhood issues, Munchausen syndrome by proxy is when most often a mother will frequently go to a doctor with a sick child. Oftentimes it's the mother enjoys the caretaking role, the hospital process, those types of things where she may be feeding the child poisons and certain things they're not supposed to have, so they become sick and get treated. Shaken baby syndrome, on the other hand, is perpetrated most often by fathers and stepfathers. Infanticide is the killing of an infant or child. This accounts for approximately 15% of all homicides in the United States. Those can be broken down into 2 separate categories: neonatocide, which is the killing of a newborn within the first 24 hours of life, and filicide, which is the killing of a child after the first 24 hours of life. Although there is no exact profile of a domestic abuser, when we find domestic abuse within families, we oftentimes see possessiveness and feelings arising out of an argument in the heat of the moment types of things that are oftentimes correlated to domestic abuse. Domestic abusers are broken into three basic categories. Type 1 abusers are abusers who tend to be less aggressive and remorseful and tend to be dependent on their spouse or girlfriend. Where type 2 abusers are oftentimes more emotionally disturbed, oftentimes personality disordered, borderline personality disorder comes to mind, a lot of feelings of inadequacy. And then there's the type 3. These are the criminally prone types of people who are often antisocial in a variety of contexts, and domestic abuse just so happens to be one of those areas. Other factors that are common within domestic abuse situations is alcohol abuse and dependency, being male, and men who have a partner of a higher socioeconomic status. So abusers may have a wife that is much more successful in the community. The man at home is more likely, definitely not always, to be aggressive.